Hello and welcome to our Harmony United Psychiatric Care podcast, everyone. I am your host, Marilyn Santiago, and joining us today is Melissa Tamayo, our physician assistant and operations manager at Harmony United Psychiatric Care. How are you, Melissa?
I'm doing good. How about yourself?
I'm doing well. Thank you for asking. So welcome back.
Thank you. It's good having been welcome back and be able to kind of discuss the next topic.
And the next topic is a controversial topic. Today, we're going to discuss about attention deficit hyperactivity disorder, ADHD. But guess what? It's not in children, it's in adults.
Yes.
So let's begin, right? So being structured is a tool, is an important tool that having a structure as an adult, because as children, structure is like, parenting 101, right? But as an adult, we have to learn structure again, which makes it a little bit more difficult and sometimes even embarrassing. Because, so what research can I, as a normal Jane Doe, right, that likes reading, is out there for us? Because I haven't seen personally research that's going on for adult ADHD, just like research for cancer or diabetes. Is there research going on that will allow our providers, not only our primary care physicians, but our mental health providers, look into and identify what treatment would be best for their patients? Is there any research out there?
Yeah, there's research. There's been a lot more looked into the genetic component to it. We understand,
Okay.
I mean, you can see the trends, right? So you can see the trends of, like I mentioned, parents deal, or maybe down the genetic line, grandparents dealt with they wouldn't have the diagnosis back then, but some similar factors. Parents definitely have it. Children have been formally diagnosed with ADHD, right? And so there's been that push to kind of figure out, well, what genetically is going on, and a little see actually the role of it outside of it, just looking at it from a symptom perspective. And I think a lot of that studies have brought about kind of the common issues that we've seen and a lot of the neurochemical changes. So dopamine, serotonin, norepinephrine, these chemicals that are now giving a little bit more structure to the diagnoses of ADHD, and allowing us to actually see it as a disorder, not something that's just presumed, because of the symptoms that they're seeing. Outside of that, and that goes back to kind of COVID and that period of time where everyone kind of got shifted, and those that had ADHD ended up seeing a lot of their symptoms worsen or become really a functional issue during that time. There was a lot of studies in regards to what switching a routine from, let's say, in person in a very structured environment to working from home, how much of a detriment that was, and putting that same person back into maybe a hybrid schedule or back into the office, how much improved, right, their symptoms were. So there's a lot that's come about from it, and still a lot being done on the genetic to kind of understand ADHD a little bit more than just the symptoms of I can't focus or I can't multitask, which is kind of the predominance that a lot of people know for ADHD.
Yeah, especially during COVID, because it was extreme. Today you're in the office, and at 5 o'clock, moving forward, you're working from home. Okay, so now what? There was not a plan in place. So it was extreme, and then all of a sudden, now you're not working from home anymore. Here you are. You already have something going on, and a structure very well put in place that probably took you months to create, to develop, and get used to. And now all of a sudden, starting this Monday, you're coming back to the office full time. Okay, so now I have to get used to another structure. So the extreme, I guess, put more in perspective that yes, you may have ADHD, because of the extreme changes and how long probably it will take you to, right, to get used to that new structure. So is ADHD hereditary? I've always wanted to ask that.
Yes. There's
Oh,
definitely a
yes.
genetic component to it. Yeah, we can definitely see kind of the correlation on the genetic aspect. Like I mentioned earlier, we'll see parents, we'll see when you go a little bit further than the parents, sometimes it's subjective to how much communication they had. Remember, these are things that were very stigmatized in the past and probably weren't talked about. So even if you
No,
did have a great grandmother or grandfather that dealt with focus concentration issues, the likelihood that they were openly talking about it is not
close
the
to
case.
none.
So yeah, so these are things that you're seeing from one, at this point, from one generation back, maybe two, depending on the openness and the mindset with psychiatry and just emotions like earlier on. But there's definitely a component of it, and we see that on a familial aspect where parents, especially siblings, there's a higher likelihood when we look at, let's say, parents, there's a 1 in 4 chance, right, that their children will have ADHD if one of the parents has ADHD. So doesn't mean everyone gets ADHD if one parent has it, or every child after that will have ADHD, but there's a higher likelihood that that's the case. And that's what we've been seeing kind of in a lot of the, testing that's been done. And then when we take surveys in regards to family, there's a strong genetic component to it.
Okay, so you mentioned testing. So is there a actual genetic test that I that could identify, okay, 1 out of 3 could have ADHD?
Yeah, so we usually do what we call neurocognitive testing for that.
Okay.
We look at more the symptomology behind it. Now, if we do testing and let's say the parent, mother or father was positive for it, we can kind of see that trend as it is. And
Gotcha.
there's been studies that have been done to kind of follow the trends throughout the family of who's getting ADHD, who's being formally diagnosed, and seeing kind of those correlating factors and those percentages. But as far as like one blood test that you do that says, oh, you have ADHD, not yet. I won't say never, because I'm sure that'll be the case. We've had some progresses in other disorders where now there's some factors that it's as easy as that.
Right.
But yes, we definitely can see that correlation when we're testing cognition, and seeing kind of those trends within families for sure.
I truly hope we get one of those blood tests that could just identify it quick.
A quick,
Um,
a quick stop
oh
and good
yes,
to go.
yes, a good to go. And okay, this is the problem. Here you go.
Yeah,
Now let's move forward with the continuity of care, right? That would be fantastic.
it would be.
So triggers for ADHD, like for example, a trigger for depression would be probably a memory, remembering someone that'll make you sad, I guess, right? So for
Mhm.
ADHD, do we have triggers? So if I'm diagnosed with ADHD and all of a sudden I have economical challenges, would that trigger my ADHD?
Absolutely. When we look at stress, anxiety, stress can cause anxiety. We know anxiety can make things worse. Financial stress, again, going back to COVID, because that was a big pivotal moment for, especially for this diagnosis and becoming more awareness to it. Financial stress became a big factor because that increased anxiety and that caused a lot of issues with focus. We know in general, anxiety can make it so where you have multiple thought processes, a lot of worrying, which takes away from your focus on what you're doing in front of you. Um, I always compare it to kind of a computer with anxiety. If you think of everything you're worried about, and if you're worried about a lot of things, you have multiple tabs open. And just like any
Right.
computer and any processing speed, if you've got 52 tabs open, and you're trying to work on the 54th, 56, there's going to be a lag, there's going to be a buffering. And so we tend to see that a lot where anxiety, financial stress, can definitely make the symptoms of ADHD or the lack of focus much more noticeable.
How about
The other
food?
one, food as well. Food is definitely one, especially caffeine. That goes right back to kind of
Don't
all the
say
changes.
that.
Yeah, all the changes, caffeine. So caffeine is categorized as a stimulant, right? And we know
Hmm.
stimulants, although we like them for the energy it provides, we understand there's a crash afterwards, right? And we know that so much stimulation can cause anxiety, right? Can make you restless, and that restlessness can then cause issues with focus, concentration. So both of those factors are definitely a component there. So caffeine becomes it, sugars as well, the candies, the quick spikes in sugar and the glycemic and then drop. That crash can cause some issues with focus. You become really tired. It's hard to focus. When you're at the top of that, you're too overstimulated and you can't focus. So those are things you definitely want to be kind of mindful of and try to avoid. We have, for those that like working out, which we usually say is a great thing, right? When it
Mm-hmm.
comes to ADHD, until you throw in the pre-workout. And then that itself has caffeine and some other things that will do the same thing, right, as other stimulants.
Right.
So those are a couple of factors you want to try to avoid, and that we've seen definitely contribute to it. Depression, stress levels around us are definitely things that cause a worsening of symptoms. We know for a fact, like I mentioned before, it's not like you just have ADHD and you can't have any of the other things. When you deal with depression, that naturally has focus and concentration issues because you're so clouded by the worry, by what's got you feeling down. You'll definitely see those become more of an issue as far as the symptoms getting worse. And then structure, routine, a lot of changes for people, big changes like changing careers, changing locations, moving, right? Those things will destabilize and cause a little bit of an adjustment period and make it a little bit harder to kind of focus and keep that routine that we know is really important in ADHD.
Wow. We could talk about this forever, but very interesting topic. But what are some effective time management strategies that you can give us? Because not only those that are diagnosed with ADHD, but all others, because I think these resources are important at all levels of life, and regardless if you're diagnosed with a mental health condition or not, I think these are strategies that we should all implement, especially when it's coming from a mental health provider that understands and knows maybe, this will work for you. So, but specifically on ADHD, what time management
I would say
strategies can you recommend?
I'm a big component of organization. So when we look at things that are visual, calendars, planners, to-do lists, on a more technical level, you can do to-do lists that are virtual, on your phone, but things
Okay.
like that essentially keep you ordered. And it's kind of a double-edged sword because a lot of patients that have dealt with ADHD, maybe before they were diagnosed or had gotten treatment, struggled with that. They know, like, planners are good to organize, and if I'm not keeping up with things, then I should start a planner. The problem is they couldn't keep up with it. So they do a to-do list. It has 25 things on it, and at the end of the day, they got done 2. So what that management tool has now become is a stressor because they only did 2 things out of
Yes.
25, and then tomorrow they have 25 plus the 2 plus the others from last week, and now this list is just not attainable.
Huge.
So with treatment, that's for saying you can get treatment, but we also have to then follow through with it. And so retrying again those methods that maybe historically you couldn't stick through, didn't work for you, are important, especially as part of kind of the follow up to medication per se. And they help with organization and time management, which are definitely my top 2 that need to be addressed to be able to be functional, especially when you have multiple things going on in your schedule, work, family life, schooling, that would require for you to be effective in your timing.
So
Outside of that, oh, go ahead.
I have a question. I'm sorry to interrupt.
Yeah.
So does ADHD affect in any way how you prioritize your to-do list? Because I'm thinking, okay, so if I have ADHD, I want to do a to-do list, I want to be structured, but everything that's here, all my 12 items, just to pick a
Mm-hmm.
number, are all as important. So
Mm-hmm.
how do I know? It will just throw me off of focus because all of them are important. So how do I identify which I should do first
Yeah,
and,
I think
move along?
The biggest thing is setting realistic goals, because you can have maybe 12 things in your example that need priority. However, the likelihood that you'll finish those to the end, to completion, is very low. And so what ends up happening, we see you start a million things, everything gets started, nothing gets finished. And then
I heard
similarly,
that.
the next day, more things continue. So just breaking it down a bit, everything has priority. However, we know we can't finish all the same at the same time. So break it down to, out of those 12, 4 things that you have to do on Monday, let's say, and you work on finishing, those 4 things. The others are still priority. However, you're getting them done in chunks, right? In smaller pieces. So it
Right.
becomes a little bit more reasonable, more manageable. And then maybe Tuesday you do another 3 or 4. And so eventually you start kind of eating away at that total of 12, instead of at the end of the week, having everything to be done as priority. And at the end of the week, you have 10 things that are half started, not finished, right? And 2 things that maybe are done, but you rush through them. So you're not sure how thorough they are. So I think breaking that down, even if it's priority, within a reasonable time, helps for you to be more effective and kind of getting that list finished, completed, and then not feeling too overwhelmed because you're overloading yourself.
How about some organizational strategies like color coding, or does that really work?
It's time consuming. So for everyone's a little bit different, right? For some people, the
Okay.
color coding, the visual aspect to it makes it easier for them. You also want to make sure, because you can go overboard with the organization, right? And you can become hyper focused on organization, and then that takes time. And then, in turn, you lose some time of other things that you could be completing. So you have to kind of figure out what works for you. And that's kind of, you don't want to start a calendar, have a planner, have 3 apps, and then color code everything, because it's too much. You have to pick the one. You try a couple, pick the ones that are easier to you to follow through with, to finish, and then pursue that as your organizational method. Because a lot of times we will see that at AJC, you hyper focus too much, right? We talk about issues with focus, but sometimes you'll hyper focus on one thing, and then you forget to kind of spread your time amongst the others. And similarly with the organization, you don't want to overdo it because you'll become stressed. You can't keep up with it, and then we're on the same boat.
Okay. So how about a person, a professional that at any level, right? Any profession, that has ADHD, how can they improve their focus at work? Because you and I know that work nowadays is multitasking. I've always said that being a multitasker is not necessarily a good skill. It could also be a bad
Mhm.
skill, right? But what tools can you give us, right? Those that have AD and those that don't have ADHD that are still having focusing problems. What strategies can we use
I
at
think the
work?
biggest thing is trying to take as much of the distractions away. I know it's hard, you can't take it all.
Hmm.
But trying to make sure, for example, your phone is away. There's not too much going on. And if you work from home, having the TV on, the radio on, the
Right.
phone going, and the computer going at the same time. So just trying to kind of modify and take away some of those distractions, to just maybe 1 or 2 things that you're using for work, so it doesn't become too overstimulating. Again, more in like a home setting, which we know sometimes people nowadays people have that hybrid schedule,
Hmm.
using noise canceling headphones, right, or earplugs that can kind of block out some of those external sounds that we may have. Someone in the kitchen, someone watching TV, someone listening to music in the house, and you can't necessarily get out of that area, but you can at least block a little bit some of those distractions, and that tends to be helpful in that sense. Outside of that, I would say just kind of piecing your time, try to set up similar to what we discussed about earlier. Set times, from 9 to 11, I'm going to do these things. I'm going to take a break from there, then reconcentrate again on this area, take a break from there, and then continue on to the last task. And that helps your brain kind of get a little bit of a break, so it doesn't become just too fatigued with the constant work. And then
So
mindfulness, in regards to what you're
that was my
doing, making
question.
sure you're paying attention to what your tasks are, and going back to that list, making sure you're still working on what you're supposed to be within that time frame you set to yourself.
That was my next question. So, I did ask earlier about food. So, any dietary recommendations that you may have, like don't drink too much soda, for example, or
Mhm.
somebody that doesn't drink soda that has ADHD, that's not that that's not into sweets, because I've
Mhm.
heard, oh, ADHD and sweets, they don't match. And okay, how about those that have ADHD that doesn't eat sweets?
Yeah, I think when we look at sweets, it's a lot about blood sugar levels, right? Glycemic
Right.
index, things like that. It's the crash. We understand we're working kind of against some of the things that we would see there. Crash and blood sugar would cause you to feel tired, would cause you to not focus as well. You already have those issues to begin with. So obviously anything that can exacerbate that or make it worse, we want to try to avoid. So yes, sugar becomes important. What types of sugars you're having versus, whether it be a candy, whether it be soda versus it being an apple that also has sugar but can kind of break down a little bit differently. So being mindful in that sense is important for the sugar aspect of it, and it's more so that factor, that drop off, and also for those kind of high sugar. Let's say food items like candy, that big peak that will make you kind of restless and will be too overstimulating, and that works against you in that sense. Um, the important part is hydration. That goes across the board for multiple
Hmm.
things, not just ADHD, but that does help. We know very well, and if anyone has dealt with dehydration before, you're tired, you're sluggish,
Yes.
right? You're not focused. And again, takes away and makes similar symptoms to what you would have naturally with ADHD. So water always becomes the best option. I know there's plenty of others. There's seltzer waters. There's all types of things you can put in water. But at the end of the day, there's nothing better than just plain water. And
I
it's
agree.
the easiest to kind of get access to and the cheapest too. So those are things to kind of look out for. We talked about caffeine earlier and being kind of mindful because that as a stimulant will do the same thing, that spike and that drop off as sugar would, high sugar foods. Not to mention it can also skew a little bit the sleep patterns, and poor sleep will cause you to feel tired or maybe a little sluggish the next day. So a lot of these let's say recommendations are more so things that have that as a result of you either eating or not doing will cause you to have similar symptoms to what we would see naturally in ADHD and augment that. So we want to try to avoid that. So you want to exercise regularly. We know that's a good way to kind of replenish some of these, let's say, neurotransmitters that we know are connected, dopamine, serotonin, right, that are connected with ADHD. We can naturally kind of replenish those in exercise. So exercising regularly, eating balanced, trying to avoid the carbs, the sugars, the caffeine, so that you're not working against what you're doing correct. And just being kind of mindful when you are eating. I know sometimes we don't pay attention. We say, "Oh, it's just one bag of Skittles, or it's just one Coke." But I was good yesterday. You want to keep kind of consistent with it, so we don't see that fluctuation maybe in focus.
Wow, I truly appreciate all this information. We have to continue talking about um, ADHD, adult ADHD. So on our next podcast, we will continue this topic, and we're going to touch more on techniques to manage the symptoms. We will also touch base on how Harmony United Psychiatric Care can help our community, our mental health population, our community in general, to not only diagnose but also treat adult ADHD. So, Melissa, I want to thank you so much for your time. I also want to thank our listeners and our viewers that have tuned in today's episode. Please remember to hit the subscribe button to stay updated on all of our latest content. Please give this episode a thumbs up. That's very important for us. We will greatly appreciate it. Share the video with your family and friends. Talk about it. It's a very important topic. Not only it may not be just important for you, but also to share for others for awareness. Spread the word on mental health wellness. It's super important. If you have any questions, if you have any thoughts, anything you want to share, please post them in the comments, I'm sorry, below, and we'd love to hear from all of you. And again, thank you all for your support, especially to our viewers and listeners. And we will catch you on the next episode. Thank you so much, Melissa, and we will talk soon.
Awesome. Thank you for having me.
Thanks. Have a good one.
You too.